First, border measures. We have retained digital declarations for travelers coming into Singapore using the SG arrival card. Several members have asked me, why do we keep that? Now you know why. Because such outbreaks will happen from time to time. We have, however, adjusted the questions so that travelers are now required to declare mpox-related symptoms and travel history on the SG arrival card. We have put in place temperature and visual screening for travelers arriving from higher risk areas at both air and sea checkpoints. Second, test, trace, and isolate. As mpox has a long incubation period, up to 21 days, cases may not be picked up at the borders. They may seek medical help later when they turn ill in Singapore. Therefore, we have notified our doctors to be on the alert to spot and immediately report any suspected mpox clade 1 cases to MOH. All suspected mpox clade 1 cases will be conveyed to designated hospitals for further assessment and testing. If tested positive, these patients will be isolated in healthcare facilities until they are no longer infectious. Based on what we currently know of clade 1 virus, our existing hospital capacity, including the ICUs, remains adequate to treat and isolate infected cases. Contact tracing will then be conducted for all confirmed cases. NEA will oversee environmental cleaning and disinfection for places visited by the infected persons. Close contacts of clade 1 cases will be quarantined in a designated government quarantine facility up to 21 days from their last date of exposure. Third, schools and preschools. We have been working closely with MOE and ECDA on contingency plans. Schools have existing protocols to manage outbreaks, such as for hand, foot, mouth disease, which are relevant in mpox clade 1 outbreak. These include ensuring good hygiene practices and screening students for symptoms. Cases will only be allowed to return to school once fully recovered and no longer infectious. Premises will be clean and contact tracing of students and staff will be conducted promptly. If necessary, outbreak management measures, including temporary closure of a class, a level, or a school, may be implemented to contain disease spread. Fourth, vaccination. Although smallpox has been eradicated, we kept some stock of smallpox vaccinations. It's called Genios, to counter orthopox viruses, such as the mpox virus. Based on our current understanding of the disease and its relatively low reproduction rate, population-wide mpox vaccination is not necessary and not recommended. It is more effective to focus our vaccinations on healthcare workers who need to care for mpox patients and on close contacts of infected persons as a form of post-exposure vaccination to suppress the transmission of the virus. Based on this vaccination approach, our existing supply of vaccines are projected to be sufficient. To better strengthen our preparedness and resilience, MOH is also looking at procuring more doses when available. Number 5, masking. At present, we do not recommend wearing a mask for people who are well, given that the primary mode of transmission is close physical contact. However, should there be evidence of significant respiratory transmission, such as outside of the households, MOH will consider other measures, such as masking on public transport or in crowded indoor settings. Our current mask stockpiles and local manufacturing capabilities will assure us of adequate supply.